Healthcare in America, it is the costliest in the world, but is it the best? Not according to a report by the Commonwealth Fund, which actually ranked the U.S. dead last in a study that included 7 nations. The report looked at factors such as quality of care and access to care. But look at the cost. If you combine the per capita, per person costs of the top 2 nations on this list, the Netherlands and the United Kingdom, you still don't equal the per capita cost of healthcare in the United States. Now, the challenge here in the United States is not an easy one. Improving the quality of care while lowering the cost and expanding coverage to all of those people who don't have it. It's why Fareed Zakaria is devoting his first GPS special of the year to laying out a roadmap for saving healthcare. Now, the special debuts Sunday night at 8 p.m. Eastern. Fareed, you have searched the world for a solution to this healthcare issue to try and map that onto the United States. What have you found?
Well, you know, in Taiwan, which is a free market country with a very vigorous free enterprise system, they had a totally free market healthcare system in the 1990s. They asked themselves, we want to go from scratch and build a new one. And they studied all the models in the world. And we asked the guy who designed the Taiwan healthcare system, what did you learn from America?
Right.
He said it was very easy. From America, you learned how not to do it.
Wow.
He said that there was really nothing they could borrow from the American case. Our system is just a total mess. In Taiwan, what they decided to do was they decided to go for a single insurer, but private providers. So the hospitals are private, the doctors are private, but you have a single, essentially government-sponsored insurer.
Right.
In other words, Medicare.
Right.
And not
paid for by tax dollars?
Paid for by tax dollars. Not surprisingly, they have the lowest healthcare costs in the world. They're up there. They're among the best in terms of the outcomes, but they only spend 7% of their economy on healthcare. We spend 17%.
And we're going to take a look at a chart which shows the steady increase in per capita spending on healthcare in the United States, or as a share of GDP, let's put it that way, starting at around 5% in the 60s up to this 17, 18% that we've got now. Fareed, let's just discuss this for a second, because there are some people who think market-based systems work best where there's competition, and yet some of the most efficient healthcare systems in the world are single payer. Whether you want that to be a socialized medical system or just like you described in Taiwan, one payer that has efficiency and has the ability to control costs through negotiation. Square that circle for me, because one seems inherently anti-capitalistic.
Healthcare is a very weird field. There was a Nobel Prize-winning economist, Kenneth Arrow, who in 1963 wrote a brilliant paper predicting that healthcare wouldn't work on regular market economics lines. And here's the reason why. You don't know when you need to buy healthcare, and at the moment you need it, a heart attack, a stroke, a hip replacement, you don't have that much money. So you can't, the normal market can't function. You need an insurance system of some kind.
Right.
Now, of course, it's possible that you were to say, well, look, you know, the market would work if you were to just say, you had a heart attack, you can't afford it, sorry, you die. But every rich country in the world has decided that's not how we want to run things. We want to give people some basic access. And once you make that decision, you have to have an insurance system. You talked very correctly about the issue of access and cost. What I found is that every other system in the world found, in order to bring down costs, you have to have universal coverage. Because otherwise you have a downward spiral in insurance where basically the insurers try to kick all the sick people off the system.
And keep the healthy people on, who don't really want to get insured in the first place.
And the healthy people don't want to buy insurance. So it's a kind of, it's a weird game where everyone's trying to game the system.
So these countries that use a single-payer system, that take the money out of taxes, by doing so, that means everybody pays into the system, sick or healthy. Here in the United States, that's the part that's under challenge at the Supreme Court. The idea that this administration's healthcare reform plan wants to compel people to buy insurance in the same way that Taiwan taxes, in the same way that Canada taxes or the UK taxes.
We actually have a perfect example, and we talk about this in the program. Switzerland, 20 years ago, had exactly the system we do. And again, Switzerland, very free market country. Actually, Switzerland ranks higher than the United States on the Index of Economic Freedom, which the Heritage Foundation puts out. The Swiss realized 20 years ago they were having all the problems we are. The ones we were just talking about. The healthy people don't want to buy it. The sick people keep getting thrown off by the insurance companies. So they went for an individual mandate. Pretty much reformed the system along Obamacare lines. The result is they've had lowered costs, higher quality, huge customer satisfaction. So I can't speak to the constitutional issues, but what I can tell you is every system has found that if you don't create some kind of either individual mandate or, as you say, just a simple universal system, the model can't work because you have to bring everybody in to spread the costs, to spread the risk, and then you work on the really tough part, which is cost control.
Sure.
And that means you've got to have somebody. You can call it what you will. It has been demagogued as death panels, but you've got to have some board of experts saying, this is covered by insurance, and this is not.
And again, that is something that happens in many countries.
Every other country.
Where a 93-year-old person who is in hospital with some, what would be a terminal illness, isn't necessarily deemed to be chronically ill at that point. There are decisions that are made about whether or not this is worth spending. Sanjay often says that we spend most of our healthcare money in the last months of life, the last year of life.
The two crazy statistics about healthcare: 5% of the patients account for 50% of the cost.
Right.
So when people say, you know, high deductible plans will work, no, they won't, because the real costs are all in those chronically ill, those seriously ill, who would be covered by catastrophic insurance or anything. And the second part is we fight death.
Yeah.
Most other societies at some point accept it. And at the end of the day, nobody's saying you can't, at 93, get that second hip replacement. The point is insurance won't pay for it.
Right.
At that point, the market is kicking. You can do what you want. The point is your insurance program can't pay for it. Otherwise, the whole system goes bust.
You're prepared for the fact that you and I are both going to get hate tweets about this, right?
You know, what I've tried to do is really ground this in fact.
Yeah.
What I've been struck by is that the whole argument against some government involvement, first of all, ignores the fact that we have huge government involvement. In Medicare is basically
Remember that sign during the objections to Obamacare which said, "Government, get your hands off my Medicare."
Right. But the second part is that everyone who makes these arguments against the government, there is some fantasy theoretical version of healthcare that they talk about. But, you know, I'm a practical guy. What I say is you can reason from principle, but you also got to reason from facts and reality. We have 20 other countries in the world that do this. All of them are able to do it better and substantially cheaper than us. So to me, it feels like the task is not to junk all this and say there's some utopia out there that's never been tried in any actual human society. Rather to say, look, we've got a messy reality with the government and markets working together. Let's fix it.
And that is the role that you play for us at CNN. You have traveled the world. You have researched systems, in many cases, healthcare and otherwise, things that work, and hopefully we can try some of them here. I'm looking forward to the special. Fareed Zakaria, GPS. The special airs on Sunday 1st at 8 p.m. Eastern Time.